So what is a data breach? What is a data breach response plan? And how do we report My Health Record data breaches? So a data breach may have occurred for several reasons. There are a few obvious and most common ones. And for those who have joined us for the previous session, you will note a little bit of reiteration here. So if you're not the authorized clinician, you're accessing a record for someone that is not in your care. If you're curious about a celebrity or a sporting TV or movie icon, or you're just curious about a family or friend, or unauthorized access. Examples. I won't go through them all again, but you get the gist. So expanding on the information that we were just outlining, that the health services providers should use this 4-step plan, and we've got access to links, and you probably find this also on the Office of the Australian Commission's website. Is how to manage a data breach. This is a preferred method following along here. The plan has been developed by the OAIC, which is the acronym that's used for the short version of the Office of the Australian Information Commission, and in conjunction with the Australian Digital Health Agency and also the Australian Cybersecurity Centre. So they've put together this little guide. So, of course, you need to contain the breach. So does the data in the breach relate specifically to My Health Record? They like to emphasize that because, of course, you have your own existing systems that's separate to My Health Record. So you would already have a process for that. So, of course, you need to take immediate steps to limit any further access or distribution of the affected information and reduce the possible compromise of any other information. Some steps may include setting or changing passwords on client databases, turning on two-factor authentication, attempting to recall any unread emails, changing computer access privileges, and disconnecting internet connectivity. Evaluate any risks associated with the breach. So all data breaches related to My Health Record system must be reported. This includes situations that have or may have, some may be familiar with the terminology near miss, so may have resulted in unauthorized collection, use or disclosure of any information in a My Health Record, and events and circumstances that may or may have compromised the security of the system. So got to notify the system operator. Again, the OIAC, you're going to find that information, that terminology threaded through a lot of My Health Record training. So when a data breach relates to the My Health Record system, you must notify the Australian Digital Health Agency as soon as practical. In most cases, you will also need to ask the agency to contact any affected individuals, and organisations must also notify the OAIC. So public hospitals and health services are only required to notify the Australian Digital Health Agency. So you have to take steps to mitigate and thoroughly investigate the cause of any breaches. You have to develop a prevention and response plan and conduct audits and to ensure that the plan is actually implemented. You have to review and strengthen your security practices. So consider changing organisational policies and procedures for maintaining data and revise staff's training practices. So I'm sure that you've already got policies and procedures in place for around security. So you would need to incorporate and modify to include My Health Record. And of course, if you need any further information, you would contact the Australian Office of Information Commission. So once you have followed your action plan, you must then report it. So reporting a My Health Record specific data breach, there are a few steps you need to go through. There is a link at the bottom of this page, which takes you directly to the page where you need to enter in all the relevant information. And there's more than 6 questions, but the essence of the 6 questions are around these particular points here. So they want to know who you are, what's your organisation, and please provide your health provider identifier for your particular organisation, so it will allow you to enter that data there. Please provide a description of the data breach and all the ins and outs of how that unfolded. You will have had to coordinated a call with the OIAC ahead of time before you actually report this, because it's going to give you a reference number, and when you report it, it's going to ask you, please provide that reference number. Request to notify affected individuals, so that is a request to the Australian Digital Health Agency, and they will do that. Contact details for provision to individuals affected by the data breach. So you need to provide that information. And then there is a confirmation, like a submit page. So it's going to ask you to enter in all those details on that particular web page. So just a little bit of a recap. So we are coming to the end now. When considering your privacy, your security, and legislation, all these things need to be considered before you go through the process to make sure that you've got all of those steps in place. So you've got to have developed your policy, and there is a template that is available, thank goodness, for you to refer to. So develop your policy in preparation for submitting your registration for My Health Record. You have to understand what your obligations are. There are 12 of them, so you need to go through those systematically and make sure that you've ticked them all off, that you've done all those particular tasks. And of course, you've got to train all the relevant staff in all of those steps. And there is a resource link page here with a whole wealth of information that we are happy to provide for you. If you have any questions, please do throw them in the chat now. We are just about coming to the end. There is some training specifically for aged care. If you go to the website, you see here on the left-hand side, there's training at all levels on every single conceivable topic around My Health Record that your team can go through to understand exactly what it is that you need to do in order to get registered, not only through the registration process, but thereafter, all the different aspects that are involved, all the documents that you can find in there, and how it will work for you in the aged care setting.